Sigue en sintonía de nuestra programación.
Ahora empieza su programa, el show del doctor Roy Aranda. Temas sobre los efectos que tiene la separación de los niños de sus padres, traumas que afrontan los indocumentados, violencia doméstica, el porqué de la violencia en las escuelas. Llámanos en vivo al 1-888-900-2811, extensión 6, y haz tus preguntas al aire. ¡Comenzamos!
Good evening, buenas noches. Good evening, my dear Tribuna TV viewers. Buenas noches, queridos televidentes del show Tribuna TV. Here we are again with another show that we hope will be helpful for the viewers and a little bit more upbeat. Modernly, it seems to be something inescapable. We're not able to really focus on too many aspects of our lives without in some way focusing on the pandemic. In one way or another, it's become a modern way of our lives. Ya el COVID-19 se ha hecho una parte, bueno, no normal, pero ya es una parte lamentablemente de nuestra vida. So it's a little bit difficult not to in some way talk about issues that the pandemic has some impact on. But today I'm really hoping to have a show with a wonderful guest who I'll introduce you momentarily, really talking about our pets. The title of the show today is Our Pets During COVID-19, in Spanish, Nuestras Mascotas Durante COVID-19. And we're going to talk basically about our loved ones, our pets, and how they're faring during COVID-19. And there's going to be a number of issues that we'll be talking with my guests. And I do want to share with the viewers, as usual, that the show is being recorded on YouTube and will be available immediately after, about a day or so later, on the Tribuna TV website, Vimeo, and possibly Facebook, and possibly other electronic media platforms. Okay, so it'll be available. There are a few slides that I'll be using, not too many. I'll be asking my guest, who's a veterinarian, and at that, an illustrious veterinarian, a lot of the questions. So basically, it's going to be really focused on an expert talking about issues involving our pets. And of course, as a psychologist and as a pet owner, I'll probably chime in a little bit on some of the emotional effects and behavioral changes of pets, and try to keep it in that area of making it helpful. I mean, after all, we all love our pets. So, without further ado, then let me introduce our guest. Is Dr. Jared Coren. ¿Se le puede poner ahí?
No, claro.
Okay, so there you go. I see you.
There we are.
There you go. I love the maneuverings of Oscar. Oscar is part of our show, so salúdale a toda la gente, Oscar. So, Dr. Jared, Dr. Coren. I didn't tell you we're doing it only in Spanish, did I?
No, it's all right.
All right. Okay. So a couple of words here and there will be in Spanish. I see you're wearing your professional veterinary garb. I mean, what? That's like your professional outfit.
I'm still at the office, so I apologize for the ugly lights and the door behind.
All righty. Okay. So I'm here at the studio with Oscar, and we're keeping appropriate social distancing. Oscar and I are about 15 feet apart. And I did check his temperature, and I did a quick COVID test, and he's fine. So that, kidding aside, really I do urge people to be very, very careful. We're in a state that the country's seeing a lot of spikings, different parts of the country. And I don't really want to focus or get into that, but I am, I feel I'd be negligent as a professional, as a psychologist, not to encourage the public to really be careful and to be safe. I certainly don't want to see anybody, suffering from this terrible pandemic. So let me put on the first slide. Por favor, Oscar, the first slide.
Okay.
And this is basically an indication of the introduction to the show for today and the dedication. And I start with pets, pets, and pets. Yes, we're going to be dealing with a lot of pets. They're like little children. They are our children. They are our companions. They bring us immeasurable joy. The show will focus on issues pertaining to our pets during these trying times brought on by the COVID-19 pandemic. The show is dedicated to all pet owners and to all the pets in our lives. My special guest, Dr. Jared Coren from West Hills Animal Hospital, which is one of the star facilities out in Long Island. I'm in Long Island, New York, and there you can see the icon for West Hills Animal Hospital, the address and the phone number for the viewers in case you have further questions you'd like to call. Also, if you go to the website, if you actually go to the website, there's a tremendous amount of resources. You'll find out all sorts of resources and things that they do, and it's very useful. So I do encourage viewers to take the time to look at it. Por favor, slide 2. And here I'm introducing Jared Coren, DVM, that's a doctor of veterinary medicine. He's proud to be part of the West Hills team and the medical director of the West Hills family of hospitals. Being the son of Dr. Alan Coren, he grew up going to work with his dad and has filled a variety of roles at West Hills Animal Hospital over the years. He obtained his Bachelor of Science degree from Cornell University, where he graduated summa cum laude. He then pursued his doctorate of veterinary medicine from Cornell University, graduating in the top 10% of his class. Dr. Jared was inducted into the Phi Zeta Honor Society as a third-year veterinary student, an honor reserved for the top-ranked members in the class. While in veterinary school, Dr. Jared was a 2-time award winner of the Finger Lakes Kennel Club Award, an award given to a student who displayed a strong interest in purebred dogs. He was also awarded the AKC Veterinary Outreach Award for his dedication to the health and well-being of companion animals. As a fourth-year veterinary student, Dr. Jared received the Neuroanatomy and Clinical Neurology Award for his outstanding expertise and interest in neurology. After veterinary school, Dr. Jared pursued an internship in medicine and surgery at the prestigious Animal Medical Center in New York City. Dr. Jared has a strong interest in ophthalmology, internal medicine, especially endocrine disorders, and reproduction. He's a member of the American Veterinary Medical Association, New York Veterinary Medical Society, and the Long Island Veterinary Medical Association. Dr. Jared has been nominated for Best Veterinarian on Long Island from 2014 to 2019. He currently lives in New York City with his wife Jessica, daughter Dylan, and Rhodesian Ridgeback Kobe. And we have a photo of Kobe to show you later. So, puedes sacar el slide. Oh, I encourage the viewers, if they want to take photos of any of the screens, please do so. Once the show's recorded, you'll be able to take screenshots anyway. So, Dr. Jared, say hello to the viewers. Did I leave anything out? Did I omit anything?
I appreciate it. Thank you, Roy. I appreciate you having me on tonight as well. I think you hit it all. You maybe made up a couple of things in there, but that's good. I appreciate that. So hello everyone. As Roy told me, as Roy told you guys, been a veterinarian since for the past almost 10 years now, and I've had I've been lucky to take care of the Aranda's dogs over that period of time, and Roy and Irma are wonderful, wonderful pet parents, even if sometimes I'm yelling at him to maybe not feed them as much as what they are getting at the time. So
they get hungry.
I know.
They get hungry, and Irma likes to give them treats. I have a photo later on of little Ginger with a little bib. So I mean, you'll get a chance to see that. But I almost watched you grow up a little bit. It's been a while.
I'm in the hospital for 20, 25 years. It has to be.
Well, we've been going to West Hill since Pumpkin and my first baby Peanut.
Yeah, 20, 25 years. Right,
and Pumpkin, my God, she good 18 years. It was like really magic. I mean, there were a lot of magical moments at your facility. A lot of times when I was there, and of course, usually I would bring one of my babies, and the moment that I walked through the door, all of a sudden the symptoms of my baby went away. They immediately got better. All of a sudden, I'm fine, let's go home, let's get out of here. Others would be super friendly, running all over the place. A few of them would leave gifts. I'm guessing you get gifts from a couple of your
all the time
of your pets. But it's great. And over the years, I've had the privilege of knowing and working closely with several of your veterinarians, and I we really came to like them. And there were some moments that we were super grateful to have had that relationship and that contact. I wanted to let the viewers have some idea of what the types of questions. It's going to really be more of a question and answer type of program. So I did want to show the viewers so that if they want to take a photograph of the questions that I've developed, just so that they have an idea. So Oscar, si quiere poner el slide 3. That's just to get an idea of some of the questions. There's another slide with questions, but things like focusing on what type of special needs there are, can they be affected by COVID, adoptions. There's a lot of adoptions. We'll focus on that a little bit more. Suggestions for people who want to adopt a pet now. ¿Me puedes poner el 4? And as a psychologist, I'm very in tune and thinking about and focused on how pets react to all of a sudden seeing their parents all the time. Say in a typical or one of many typical situations, one person is at home, one person is working. Now, more likely than not, you've had people that are home 24/7. And of course, what sort of an impact does that have on a pet? And then also what might happen to the pet who starts getting used to seeing daddy all the time, and then all of a sudden daddy has to go back to work because maybe phase 3 or whatever of the reopening, and the person's able to go back to work, and what sort of emotional impact that might have on the pet. So things like that, and focusing on different kinds of pets, and pets that might be more suited for people who have disabilities, or pets that might require lower maintenance, pets that are particularly good for people who suffer from anxiety or depression, and so forth. So I just wanted the viewers to see this. So puedes sacarlo. And so Dr. Jared, I wanted to focus, at the top with, I mean, obviously you're working. What are some of the medical needs that you've seen with your pets during COVID-19? Have the needs changed? Are there certain differences, certain medical needs that are more prominent now, or you're more concerned about some of these things now?
Yeah, so I would say the needs are very similar in what we've had over the years and what we have right now, and for the pets' medical needs. I think a lot more people are paying attention to their pets right now. So people have gone from being out at their office for 8, 10, 12 hours a day. They come home. They don't know what happens during the day. They may not have a camera on. And now you're paying attention. You're saying, all right, well, wow, my dog is really itching a lot. Or something is going on that I may not have realized. Or people are potentially picking up on things a lot earlier now than what they were previously because they're around more. And so that is something that I'm definitely seeing. And we're really seeing across the industry. All veterinary hospitals, friends and colleagues have experienced a massive upsurge in patient visits over the past 2 months. The end of March, everyone was sheltering in place and no one was coming out. But as people stayed home looking at their dogs and spending more time with them, I do feel like we've seen a big uptick in visits that may not have happened beforehand. And because people are around and seeing that. Obviously, we've seen a lot more new adoptions and new pets in households, new purchases of pets, adoptions of pets and such, which has also driven the pet ownership up substantially over the past 2 months, and which I know we'll talk about as well over throughout the show. But that's a big thing that we're seeing. Medical needs wise, I do feel like, and we joked about the treats earlier, but I have seen people when they're coming in or the dogs are coming in, they're gaining weight now. It is something that exercise, I think we all want to get out there. We all want to do things. I found in myself, I know that I'm certainly not exercising like I used to because I'm at home most of the time and I'm trying to get out there more. But at the beginning, everyone was scared and no one wanted to leave. And the thought of going on a run just wasn't going to happen, especially in New York City where I live. So those are the things that I think pets haven't been, and they're starting to now, probably more so, but weren't walked as much at the beginning. People were letting the dogs out. They were coming right back in. The same thing they were doing for themselves. So I do think that is something that we can definitely focus on. And because we're around more, we are oftentimes feeding more. We're sitting there, we're throwing them treats, we're throwing them. I know I was doing it with my own pets, and that's something that we definitely do see as well.
So if pets are gaining weight, which stands to reason if they're not going on runs or walking or getting out the way they were before with the owners, it would stand to reason that there probably has to be closer monitoring of the diet to make sure that they're eating healthy and not overeating, and to be careful with the consumption of calories.
Yes, for sure. And we definitely need to watch that more so because, as I say to all clients, either you're going to really simplify it, either you're going to take in more calories. If you want to lose weight, you either got to take in less calories or you got to burn more calories. And those are the two ways that we have to look at that. And if we're not burning the calories because we're not getting out there and exercising, then we have to watch what we're eating even more so, or what we're feeding our pets. And we have oftentimes a little more control over that. Some would argue the other way, but because it's tough to look at them and not feed them something off the table. But we're eating in more, a lot of us, so we're not going out to dinner. So now we're feeding from, again, people are getting treats from the table, or dogs are getting treats from the table, same type of thing. So it's, from what I gather, speaking to people in the human field, that I think that there's a big concern that we're going to see that in humans as well. And I don't know if you have any insight on that, Roy, as far as, gaining weight and people gaining weight because they're not exercising. I know that you're mentally, people that go out and are able to go to the gym or do something outside, and now they're not going outside as much. They find themselves in a cycle of then not wanting to do that because now they feel like they can and they're out of shape, and they're less likely to do those things emotionally as well. So
I know that the context is difficult because, for instance, I live on the island. I have a house, and I have a backyard, and I'm able to actually go outside, and I don't have to risk going outside and wonder, with PPE. Worrying about people social distancing and whether they're wearing masks or not. I have the safety of the yard. But there's many people that are living like in small apartments, and people in Manhattan in large buildings. Obviously, they don't have the freedom or the facility to move around as much. But I know that among my own patients, they're telling me, and I always encourage them as well, to watch their diet and their appetite. And that a good bulk of my patients are patients who suffer from health-related and accident-related occupational kinds of injuries. So many of them are having medical issues, and they're having difficulty with ambulation, difficulty doing things physically, and health problems. So of course, one of the things that I'm focusing on with them, things like proper sleep, proper diet, but even inside the apartment, they're able to walk from the kitchen around, do some movement. Some people who have steps, go up and down the steps. Some people have purchased, exercise cycles or some kinds of things that they can use, simple kinds of exercise machines for the home. So obviously that's for the person. That's not going to be for the pet. But nothing prevents, chasing or, you play hide and seek with if it's a dog. I don't know that a cat's going to be that receptive, but a dog is probably receptive to wanting to play hide and seek and run around. So there's some opportunity, some ability to move about. A big question that has come up a lot, and I think there's probably confusion about how accurate is it. But are pets at risk of being contaminated with COVID-19?
Yeah, so good question, and it's one that is still not fully understood at this point in time, which is why I think there's so much back and forth and everyone has feelings, which is somewhat surprising that we really haven't been able to hash it out the way that we would expect. And when people ask me this question, I always say to them, if dogs were truly going to be infected by COVID-19, we would have seen cases with way more prevalence than we have right now. So there is an assay, so it's not that we can't test. There you can test. IDEXX, which is one of the reference laboratories for veterinary medicine, is able to do COVID-19 testing in pets, and you guys have probably heard about people the zoo animals were testing positive. So when I'm referring to it, I'm really specifically talking about dogs. So dogs have not been. There's been a few positive cases. I believe that they're probably positive cases from particles. I mean, it's a PCR assay, so if you are detecting viral particles, you'll potentially be positive on that PCR assay. And so because of that, if they were in a house with someone that has COVID-19 and you're around your dog and you're breathing on each other, then you could potentially transfer those respiratory particles to that dog, and whether or not they're going to become symptomatic or not is a different story, but they'll still test positive on the assay. You could be coughing for a multitude of reasons and come in coughing and then have that test ran, and are you positive because of that, or are you positive, or are you coughing because of that, or is your dog coughing because it has bronchitis or something else that's present, and that's why we're coughing too. So there's been only a few positive cases. There really hasn't been hashed out. Now cats and the thought is that they actually don't have the same ability to replicate within the body and the same ability from a receptor standpoint. Now, cats and ferrets, they've actually shown do have the receptor that's present for the coronavirus, for this specific coronavirus. And dogs, just to back up, dogs, just like people, have had coronaviruses for years. So many of the viewers out here may have even heard their dog be vaccinated for corona. Roy, you may remember, we used to vaccinate for corona way back when. Different type of coronavirus. It was a GI coronavirus, not a respiratory coronavirus, not the COVID-19 virus. But we would sometimes run respiratory PCRs on dogs 5-6 years ago. They were testing positive for respiratory coronavirus, which exists as well. So as we all know, this is a different strain of coronavirus. It's not the same thing, but dogs and cats will get coronaviruses. FIP, which is feline infectious peritonitis, which is a deadly virus that kittens get, is a coronavirus as well, and it's something that's being studied being looked at. Some of the drugs that we use for those cases are actually being looked at it with COVID-19. So as far as receptors go, it looks like ferrets and cats do have the receptor, which is why you're seeing these big cats in the zoos testing positive. So they may be able to get symptomatic from COVID-19. I don't believe that dogs are going to be able to be carriers for this or transmit to people. Cats, ferrets, questionable. There's been no studies that have shown that they've been able to transmit the virus to people, but it does appear that they can be infected by it as well and may be able to spread it between their own species.
Are there any precautions that pet owners should take if they take their pets outside? And I don't mean to a backyard. I mean outside to the street, other than, the usual thing, on a dog on a leash and so forth. Any special precautions? Because some of my patients, they take their dogs out for a little walk. I have a female patient. She has 2 little dogs, and she puts face masks on her dogs. And I've seen on the internet, dogs wearing face masks. I don't know if that's necessary or not. But when they come back home, they wash down the pet's paws.
Yes. So I would definitely wash down paws. That is essential there. I would look at your dog like any other piece of, I hate to say it this way, but like any other fomite that we would potentially be bringing outside. So like ourselves, for instance, our bodies, yes, we can inhale particles, but if you're touching different things, you're going to want to wash your hands. You're going to want to shower when you get home. For dogs can serve as fomites as well. So if someone's in the vicinity breathing in particles. Now, you go for a walk on the street. Those viral particles are not living there for any period of time. But if you're going into a place and someone happens to have COVID-19, is not wearing a mask, coughs on your dog, could those particles live on your dog for a period of time and you bring those particles home with you? It's a possibility. And then you touch your dog, touch your eyes and nose, and now you have the virus. So they could serve as a fomite, they could serve as a vector that way. I wouldn't worry about them wearing masks and picking up the virus the way that we think about picking up the virus and the way we're wearing masks, as masks are more for the other side of it, for us to not transmit it to other people anyway, and so they're not going to be transmitting it to other people. So I don't think that that's going to be a necessity, but I certainly would, if I was bringing my dog to an area that I felt like the people were not taking special precautions or proper precautions, then I would be less apprehensive then I certainly would bathe them or wash them when I got home. And where I normally stop on the street and pet dogs, I will not. And just in case I have something on my own hands, and so I would tell the viewers, not to be paranoid, but if it's some random person on the street who wants to pet your dog, I don't know that now's the best time for that, just in case. It may not be worth it, and there's a nice way to say, maybe. And
you might as well not go any place where people are coughing or sick, or ahead of time. Yeah. So in essence, a pet can become a fomite also.
Absolutely.
So why don't you explain to the viewers what fomite is?
So fomite would be a source of infection that's not transmitting the infection themselves. So a fomite would be our phones, for instance. A fomite would be anything that I would touch that would. So it could be this
table here, like somebody was infected and coughed or touched the table is a fomite.
Exactly, and then you touch yourself with that. Off your table, and then you could pick it up that way without direct transmission.
It's my understanding that people touch their faces between 2,000 to 3,000 times a day.
It's crazy.
I don't know if that's accurate, but it sounds about right. 2,000 to 3,000 times.
Yeah, it's people touch their faces all the time without even realizing it.
So, given now that there's these regulations and. For instance, my older son, has to have surgery, and he's at North Shore, and I went there, and it almost was like a scene out of Contagion, out of the movie Contagion. It was like I felt like I was walking through a bubble, and they were allowing only one visitor per day. So that's how strict. They were there, so I have to assume, obviously, and I know because we've gone to pick up medication at West Hills, that there are restrictions now. So what happens like if a pet is sick now? Because I'm concerned or worried that that viewers, pet owners, given the restrictions, given the fears, because there's certainly a fear. I've heard this repeatedly among my patients. I'm afraid to go to the hospital if I'm sick, because if I go to the ER if I'm sick, I'm going to end up catching COVID-19, and then I really will be sick. So they're not going. They're not going because they're afraid of becoming contaminated, and obviously that's very risky if you have asthma and you have, other cancer, you have other kinds of illnesses, problems with diabetes. So I'm wondering, are you seeing, is there like a hesitation, and are pet owners more inclined to let's wait it out now rather than go to the doctor? Are they stalling more for the vaccines, for the regular kinds of veterinary visits?
I think some are, and I think some are at the point now in New York where we are, where people are starting to feel more comfortable. Certainly, absolutely. March, April, people were calling all the time, not comfortable coming out, not comfortable coming for vaccines. And at that point, I agree. I would push my own dog's vaccines off for a couple of weeks, for a month, given what was going on at that time. We tried to make our patients and clients, I should say, feel as comfortable as possible. We stopped letting clients in, like many veterinary hospitals that the viewers probably have gone to as well. We stopped letting clients in the building for our protection and their protection. And so we were sending someone in full PPE out to the car to bring the pets in. We would call, get a history, go over everything, bring the pets in, examine them, go over everything on the phone, discuss what we wanted to do, call the client again. And so we tried to do this curbside setup. We would run medications out, or I should say we still are doing all these things, running medications out. We've really changed our workflow to allow for the safety of everyone. Everyone is always in a mask in the hospital, even within our own hospital. Everyone wears a mask and gloves during the day, and we constantly clean within the hospital. So we're doing things without other people coming in, that we want to make sure that each individual person within our hospital is protected, that our pets are protected, like we said, talk about fomites and such. We don't want anything, God forbid, to happen to anyone. So that's why we're trying to take restrictions to the best of our ability. And it's really been, knock on wood, been a good setup so far for everyone to make sure to make sure that everyone is taken care of the best way we possibly can.
So at a minimum, make the phone call.
Oh, yeah.
Make the phone call at a minimum. What happens? I've had patients, and not making phone calls to veterinary hospitals, but I've had many of my health patients tell me that they've tried calling their doctors. They've tried calling their lawyers, and they get nothing. They if they're lucky, they get an answering machine. They don't get a call back. It seems to be improving a little bit right now, but it's been like dead silence for quite a while, and many of my patients were without treatment, without medication, without follow-ups, without anything for probably close to 2 months. So at least I'm glad when we call, there's always somebody to answer. That's good. So people should at least make the phone call when in doubt.
Without a doubt.
You would be in a position then to say, well, wait another day, or you need to come in.
Exactly. And some of the things can wait, and some things need to come in, and you wait too long, and it's more of a problem.
Okay. I wanted to focus a bit now on the pet adoptions and or purchasing pets at this point in time. What's going on? I mean, why the you've seen an upkick. What is it, like twofold, threefold? What's going on there?
Probably 4 to 6-fold, honestly.
Wow.
For this time of year. It's crazy, Roy. I don't know. So I people started getting puppies in mid-March, and I'm thinking to myself, this is crazy. And they were coming in, and they would say, you know what, I'm off for 2 weeks right now. This is before we knew what the extent of this was going to be. I'm off for 2 weeks right now. They shut down my office. I'm home. I'm never going to have 2 weeks off at any given time in my future. And I'm going to be with my dog. And so at least I can train him. I can be with them. And it's going to be uninterrupted time. And it'll give me something. I can't leave the house, and so I can't see anyone. So I could have a dog or cat join my family. And it's a great time. And I'm saying, you know what, that's actually a very reasonable thing. And it is a very reasonable thing. People then continue that, and everyone is, a lot of people have gone out and bought, adopted, purchased. I've heard stories of 1,000-person wait lists for dogs to adopt a dog that someone saw online, and applications are crazy. You can't even, I heard the shelters are cleared out. You can't even get dogs at this point in time for a lot of breeds and a lot of, and if you want to adopt, it's very, very difficult right now as well. It's really a crazy thing. But my hope is that this is going to be good for everyone, and everyone's going to love and take care of their pet. We'll see what happens in 6 months. I was concerned about the financial impact that this is going to have, and still am concerned about the financial impact that COVID-19 is going to have on our society. And will that trickle down to pets? And that certainly is a reasonable thought and reasonable concern.
Well, having a pet costs money. The food and the medical care and their clothing needs and all sorts of supplies that they need. It's obviously it's a family member. You're paying to support a family member.
Exactly. So hopefully everyone who went out and got a dog wasn't thinking short term and was thinking long term. Because the short term, it's brilliant. It's great. I'm home. I can train them. I can be with them. They're going to keep me company. I'm going to keep them company. It's excellent.
Do you have recommendations for the viewers? Because I know, historically, I know that I've seen issues where, like, maybe, somebody wanted to get a very frisky large dog for a 3-year-old child. I mean, it may not be the best fit. So, I mean, are there kinds of recommendations ahead of time, like read up on the breed of the dog, find out about the temperament, find out if they're okay being solo? Are they okay with other family members? Are they okay with other pets? Stuff like that.
Definitely, and you have to read up on a dog, because dogs, for the most part, are really true to their genetics, especially if they haven't been diluted extremely. So many golden retrievers, well, they've been diluted out a little bit, but certain types of breeds, golden retrievers, are typically a very friendly breed. They're the dogs who are going to be jumping on you when you come home. They'll be excited to see you, and they'll wag their tail up until the end. And so a breed like that is way different than one like a Chihuahua or someone like that is...
they're little terrorists. I've had so many of them, I know.
Exactly.
What about cats? Any less of an issue with cats?
Less of an issue with cats? Was that? Sorry about that, Roy. You cut out a little bit.
In terms of adopting or owning a cat, is it a little bit less of an issue in terms of the breed? And I mean, I'm guessing that owning a Siamese might be somewhat different than the Siamese
are going to behave different than certain other breeds of cats, but sorry about that. So they're going to behave different than Russian Blues and other breeds, but I would say for the most part, cats, a lot of people get domestic short-hair cats. That tends to be the kind of cat that most people are going to have. If you're looking for a specific breed, of course, look into them before you end up purchasing. Yeah. There's less of there's dogs of a much more diversity in that regard.
Yeah. I know we're focusing mostly on dogs and cats, but I really want to make a point of saying that there are many other pets. You have parrots, you have parakeets, there's hamsters. I mean, there's all sorts of other kinds of pets. I have a box turtle that I have a photo of the box turtle. I'll show you later. So there's certainly many other kinds of pets, and I don't mean to just focus so exclusively on dogs and cats. So I hope that the viewers, are tolerant in understanding that there's many other pets, and I think that that's perfectly fine too. Whatever you can afford, whatever size of your apartment, that might be an issue. You may not want to get a Great Dane if you're living in a studio apartment. Like little things like that. You probably need a little bit more space. Okay, so those are some of the recommendations then for pet owners. I assume that when you either adopt or buy the pet, there should be some sort of, you should be getting a pet that's healthy, that has whatever shots, whatever preliminary workup. I know that, like, when I've gotten little babies that were very young, I've always immediately brought them to you the day after. But I always made sure to inquire as to the history, what was done, and get the medical records, and actually bring them with me to my first appointment. So I'm guessing that if it's a reputable facility, it should come with some medical supervision ahead of time.
Without a doubt. Yeah, I mean, every puppy, by the time you get them, if you're getting a dog above 8 weeks, should have its first vaccinations or vaccine, and at least come with some kind of paper documentation. You want to know who, if you're getting from a breeder, you want to know who the parents are and track lineages and such if necessary.
Okay. Do you have any recommendations if there are people who are having financial limitations in terms of caring for a pet? Obviously, there's two ways of looking at this. One, if you're going to adopt a pet and you're already having certain financial or budgetary constraints, you need to try to stick within your budget. The other is if you were gainfully employed and you stopped working and you're collecting unemployment, or you're depending on some sort of incentive money from or assistance from the government, and or the unemployment is running out, or you're worrying financially, but you already have the pet. Any recommendation? Are there any forms of assistance? Anything at all? Any way of getting pro bono treatment at veterinary facilities?
Yeah, so for sure. So there's definitely a variety of options when it comes to that, and it's going to be over the next couple of months. I anticipate it being something that comes up even more. So things that can be done. So insurance for dogs is definitely something that should be looked into by each individual pet owner. For some pet owners, it makes complete sense. For others, it doesn't. It tends to focus on major medical issues, so it helps, God forbid something happens and there was a large bill that you needed a big hospitalization or surgery, and it was a bill that you would never be able to pay normally on your own. The insurance helps offset that.
You can get that medical insurance at the very beginning, when they're more likely not to deny you.
You can get medical insurance at any time for your dogs, as long as they don't cover pre-existing conditions, but you can still get, and you should ideally get it before any issues arise, of course, or you need to get it before issues arise. And so it's something that kind of helps plan, and you pay a deductible, and then if anything is over that, they're typically covering 90%, which allows us to be a lot more flexible should the medical issues arise, and if anything comes up there. Of course, there are other payment options that people have, whether it be payment agreements or care credit or Wells Fargo has a product that's also very low interest. So there are different type of payment agreements that are out there as well. Unfortunately, there's not much government assistance when it comes to pets, so there really aren't any true pro bono pet hospitals that are funded that way. There are some programs that are at the nonprofits that are out there. So the ASPCA, the Animal Medical Center, sometimes they have funds that they're able to allocate for different individuals. And there are certain things that you need to be able to say to show that you are in a certain tax bracket, or your family income is under a certain amount, and then they oftentimes are able to put funds for those. They have funds put aside for those people that qualify, and it has to obviously be good prognosis for the pet. So there are certain things that are out there. Definitely, there's not just one widespread, okay, go here, this is where you should be. It'll vary with different parts of the country, obviously, as well. But certainly from a planning standpoint, thinking about something like insurance, if you're in that category, and then obviously planning and knowing what your average fixed costs are going to be. Your food is not going to vary that much. Your things that you want to buy, your toys, something along those lines, you should be budgeting for and thinking about it in advance, not reactive about it. You should think about certain types of costs for wellness care. Unfortunately, we all know the medical
and
stuff that comes
you would try to prioritize along the lines of the most important things, food,
Exactly.
medication, stuff like that, and cut back on maybe things that are not necessities, like cut back on toys or resist the urge to buy a toy every time you go out.
Exactly.
Like
right.
Irma.
That's important.
Hi, Irma.
I was going to say the same thing.
Oh my God, she's going to get me for that. Every time she goes to your place, she walks out with toys and God knows what.
Every time.
So, have you seen behavioral changes because of COVID-19 in the pets? Because of people, having to stay at home and some of the stresses, maybe financial stresses, or the kids at home having to homeschool, and now you've also got pets and there's less money. Have you seen pets in some way change behaviorally?
Yeah, so I get the calls from clients more about that than me physically appreciating it, because of course, they come into the office and it's more of a conversation than anything else. Nothing I'd appreciate on physical examination. But as far as clients calling me and telling me that, their pet is doing this or that, or showing certain behaviors that they never showed beforehand, starting to pee in the house or act out in whatever way they mentioned, we're definitely seeing things like that without a doubt. And I think we're going to see more when people go back to work, like we were talking about before. I mean, if people are
they'll have separation anxiety now. All of a sudden, they'll be missing somebody.
Definitely.
And the on the other hand, with the overexposure, they don't have time to just be by themselves, just like chill out. Like dogs and cats, they spend a lot of the time of the day sleeping, and you're going to have, if they're excited and moving and too much hustle and bustle in the home, that's bound to to raise, I think, anxiety a little bit.
Definitely. And if you're used to something for 10 years as a pet, which is 60, 70 years in a human lifespan, and you've done the same thing all the time, and now that suddenly changes, just like our lives have changed substantially, so have theirs. And sometimes it's for the better, and sometimes it's not. And sometimes we think being around more is going to be better for our pets. And honestly, sometimes they don't want us there as much. So it's a realistic thing. And so they may like their alone time just like we like our alone time.
Well, they also react to us behaviorally as well. I mean, if we're at home all the time and we get frustrated and irritable or whatever, they're going to react and sense that as well. They're going to react to sickness of family members. They're certainly going to react if somebody, if there's a loss because of the virus, or if there's quarantine. So if somebody has to be quarantined in the house for a couple of weeks, then that means like nobody really is going to see that person for several weeks. So I'm sure that they're sensitive to. Dogs are super sensitive. I mean, they pick up on emotions, and if a pet loses another pet family member, they mourn. I know I've seen that in my own babies time and time again, and I've had to try so hard myself not to show my own mourning when I had a loss, just so that it wouldn't be picked up so much by the pet. But like I have three little dogs, and they're. I go here, they go there. I go here, they go there. I go here, they go there. It's like they're imprinting all over the place. So there's behavioral changes. Noises seem to affect them a little bit more. They hear outside noises since they're not moving as much, they're not going out as much. Whatever they're picking up through their senses, they seem to be perhaps overreacting a little bit more.
Yes, definitely. And they can feel things that we don't appreciate or recognize it, and they do feel it and know it, what's going on, and they do feed off of our emotions substantially. You're 100% right there, Roy.
Are there particular pets that you would recommend for two different types of people? Those who have disabilities, and I know disability is a very, very broad term. I mean, it could be orthopedic, it can be visual, it can be, any of a number of different kinds of disabilities. Do you have like any recommendations for pets for people with some sort of a disabling condition, as well as people who are maybe prone to bouts of anxiety or depression?
Yeah, so I think that there's like you mentioned, there's so many disabilities is definitely a broad spectrum when you mention it, and physical disability is going to have a much harder time with a large breed dog than they may have with a cat or something to that effect. And emotionally, I think that when you think about some of these disabilities and some of the ability for people to bond, which is really what we're looking for with any of the conditions that we're alluding to here, you're going to see someone who's may suffer from depression may get excited to see a dog when they get home, and one that's going to be not just laying on the couch, but going to be coming and greeting them at the door. I mean, we all smile when we get home, and our dog's happy to see us, and it brings us joy. And when you've had a crummy day at work and you get home and someone's actually greeting you with kisses, and it's not your wife necessarily, your husband, it's nice for
this is so traditional, like with senior citizens, and they have these the dogs, and they light up. They light up when they see them. I mean, it's like joy in their eyes.
I mean, I'm sure you've seen at the hospitals, or you may even bring in dogs or not. I mean, the therapy dogs that come through, they bring a lot of joy to people who are laying in bed all the time, and they're excited to see the dogs walking through the building.
What's your sense? I know I didn't write this in the question, but I'm going to ask it anyway. What's your sense of comfort dogs? Because I know that there's like a lot of mixed views. There's people who say it's abused and overused, and people just trying to get away with things and trying to, get free passage on airplanes or bring them onto the airplane. And there are those that are saying, I really need my comfort dog. What's your sense? Because as a psychologist, I do see that they bring a lot of joy and happiness, but they may not actually fit the law. I don't know.
Exactly. So, and I think you're right. So the ESA, the emotional support animals, it's become over the past 5 to 10 years, kind of a little bit of a scam, so lack of a better word, that people can get by without either paying for their dog to be on the flight. If they have a doctor's note, they're able to say this is an emotional support animal, and you really can't ask for more than that with the privacy guidelines that are out there. So now a lot of the airlines have us fill out forms. It used to be you could walk onto a plane carrying a doctor's note and that's it. And so it was something that a lot of people took advantage of. And so now they've tried to reel it in a little bit more, the airlines have, and so we have to sign forms and documentation. As veterinarians, all we have to do is write that the pet's healthy.
I have to guess that now it must be especially difficult with such limited airline travel anyway. I mean, I don't really know how it's going to happen right now.
I think a lot of people do find comfort traveling with their pets, and there's no doubt about it that it is probably there is absolutely a subset of people who really do makes them fly better having their pet with them. A lot of people have anxiety flying. Yeah. I know my wife is one of those people, and she's happy to have a glass of wine. But if our dog was sitting right next to her, that would probably serve as that glass of wine for her without a doubt.
Yeah, well, I know. My dogs always come to greet me at the door. They don't ask for allowances. They don't go on dates. They give unconditional love. They leave presents every now and then, but they're always happy. I call them my four-legged babies, and to me, they're always babies. This thing about counting years to me makes no sense. I mean, 7 years is 1 year. To me, they are whatever age they are, and that's it. I don't focus on all of that stuff. I know that I had asked you if there were any stories that you had about some of the pets, and you told me that in your business, obviously a lot of it is you're dealing with health issues, but I know that you've seen my own babies jump into your arms, and you've seen the smiles of some of the pets, and you've seen some of the pets' excitement when the owner comes to take them home. That has to be absolute moments of joy. Anything in particular stand out for you? Any one or two particular scenes that you remember?
Yeah, the biggest things that stand out in general, and I'll keep it broad there. I mean, when you have a patient in the hospital and they've been in the hospital for 10, 12 days, I mean, we get emotionally attached to these patients, and we've had a number of them over the years that you, unfortunately, I mean, you've been with them 24 hours a day, maybe not personally, but as a hospital, we're open 24 hours a day. We have doctors and technicians around the clock. So we're treating these very, very, very sick animals, and many times you see you bond with the client. Clients can spend hours under normal situations at the office, sitting with their dogs, visiting, such, and you get to know them, you get to see them, you get to see that dog or cat or rabbit or ferret or whatever species it is over those days, and they go from in this great cases that have pulled through where you didn't think that they were necessarily going to, and these guys, they're sick, and you give them time, and what I say to everyone is, if you have a sick pet and you can do that and you can give them time and you can pull them out of that degree of illness that they had previously, to the point where they're on multiple medications and such, and then you start to see them improve, and you start to see them get better, and then they start to eat, and then they start to eat on their own and take oral medications to the point that they're going home. I mean, that joy and that smile that you get.
They respond to things like mommy's here, daddy's here, you're going bye. I mean, they perk up. I mean, it's like as one of your clients, I mean, I've seen cases where like a bulldog come out with the collar, and all of a sudden sees the owner, and oh my God, that tail is going, and they're jumping for joy, and it's pure joy seeing that, and it's also pure joy seeing how loved they are by their human counterparts. It's the bond is I can't measure it, but it's a wonderful, beautiful thing to see.
Yeah, it really is, and where we practice and where we live, it happens to be our clients are great, and they love their pets, and they're really willing to do whatever they can for them.
So I wanted to show some photos to the viewers to sort of like end the show a little bit on an upbeat. Oscar, ¿me puede poner el próximo slide? I have some photos here, and a surprise for you, but I think you're aware of it. But a surprise for you. So that's you. Is that not you?
Oh my gosh, I don't get to see Roy on the.
Oh, okay. I have you and your baby. Your baby is Kobe, right?
Yes, he is.
And Kobe is a Rhodesian Ridgeback.
Yes, he is.
What is a Rhodesian Ridgeback?
The best breed around. No, talk about breeds that fit the people. They're mellow. They're 120 pounds. He's a big boy.
Wow.
Yeah, he's a mellow giant. He happens to be a
It's the photo that you sent me, and it's like you look so happy, and your dog looks so happy.
Got it. Yeah, I know the photo now.
Right next to that for the viewers is a photo of my toy Yorkie, Pookie, and Irma decided, like one of the new skills that she picked up besides doing my hair. She became a hairdresser. She's a professional nurse, but she also tried on, hairdressing and stuff like that. So she gave Pookie a hairdo, and it looks like a unicorn. It's like a unicorn hairdo in the middle. And she also decided that she would baby my little teacup Chihuahua Ginger on the far right. So little Ginger, who's like really tiny, about 5 pounds, is wearing this little bibs, looking, and she's, getting ready to feed a very nutritious, specially prepared meal for dogs aware of their dietary needs. Underneath that on the left is Pookie playing peekaboo. She actually put herself into this blanket, and she's peering out from under the blanket. In the orange outfit, that's my large full-size Yorkie Coco. You've of course you know all of them. You know Pookie, you know Ginger, and you know Coco, the big one. So that's Coco. And scrolling a little bit down. Those are not pets. Those are some geese that were commanding the entire road, and I decided that I had to take a picture of it, and I put my emergency flashers on to make sure the cars would be aware and not come and accidentally strike any of them. There were this was like right around Father's Day, so these little goslings were taking a little walk with Daddy on that day. On the far right is a llama. A llama with looks like a straw, but nice little pet, pet llama. Puede poner la última. And here I have all of my 3 together. You can see the relative sizes of the 3. Coco, the biggest one. Pookie is a very small toy. Both of them are Yorkies, and you see little Ginger on the far right, considerably smaller, about 2 pounds lighter than Pookie. On the far right is my niece, Evelyn, and her little Chihuahua Louie. And this was like right around Valentine's Day, so she's got like a Valentine's Day outfit. ¿Se puede ver las orejas? Yes, see, she's got like a Valentine's outfit, and that's her little baby Louie. Y subiendo ahora. And the last picture is my box turtle Gina. So, viewers, you can see that like I'm into other pets too. I don't have a photo of my macaw. I have a macaw Paco. So Paco didn't make it into the photo shoot, but I also have a macaw Paco. So puedes sacarlo ya. So basically, any parting comments? We're coming to an end. Anything that you'd really like the viewers to stick to? Any particular message that you have for the viewers who are pet owners?
Yeah, I as these future months come up and come around, and we need to remember that a pet if we're thinking about getting a pet, if we already got a pet, we need to remember that they are a part of our family, and they're going to need to continue to be a part of our family, and that's something just to be aware of. I don't want to see the shelters filled up again in 6 months with people who rethought themselves once they end up back at work, and that's certainly a concern for our profession. And so that's just something we'll just to keep in mind.
Oh, do those things, I had forgotten to ask you, we're coming to a close, but I had forgotten to ask you, July 4th and thunder, pets get nervous and scared and anxious. Do those things work, those jackets and music for pets? Is that legit?
I mean, with all the fireworks that we've had going off and such, they work okay. There are certainly medications that we utilize, and trazodone and Cilia, which is dexmedetomidine, oral mucosal gel, we'll utilize for patients that are really stressed out.
So medication's actually better then?
Medications that are human medications that are utilized. I mean, human and pet medications that we utilize for anxiety.
Yeah, okay. Because what I do is I tend to turn the TV volume up, And I'll hold the dog and try to comfort the dog. Obviously, I don't let them out when there's the fireworks and stuff like that and the thunder. But it's so unpredictable, and little Ginger starts shivering, and Pookie becomes angry. She actually gets into rage, like a rage reaction. Coco couldn't care less. She just is relaxed throughout the entire thing. So I guess it's a different thing. So okay, so it's good to know that. My last comment is, I do want the viewers to know that, certainly those of you who are pet lovers, my heart goes out to you that your pets are safe and that you guys are all safe as well. If you're considering becoming a pet owner, please, by all means, do so. They're lovely members of the family. You just need to be informed. You need to be informed, be careful, know what you're doing, know what you're getting into, plan it out. If you have further questions, call me or call Dr. Jarrett. I gave you the information at the very beginning, West Hills. Do you have a phone number you just want to quickly give out to the viewers?
Phone number 631-351-6116.
Okay, so that's a wrap for today. Oscar, tú quieres despedirte?
Bye-bye.
Oscar's saying goodbye. He's going to run out and and buy a dog right now. He's on his way to adopt. So viewers, please, be safe. I continue to hope that the shows are useful and of benefit to you, and be safe and be kind to one another. Be kind to your pets. Enjoy your families. And in 2 weeks, we're going to have an interesting show on reinventing ourselves as society reopens. So that's going to be in 2 weeks, and I have a wonderful guest for that show. Dr. Jarrett, thank you so much for being a guest. Thanks so much.
Thank you, guys. Have a good night.
Okay, buenas noches todos. Good night. So, acabamos bien.